Hello and good morning. Thanks for coming for our training session. Today we'll do about half an hour of alignment, structural alignment work. And then in the second half hour will be weightlifting for bone density building, rotational core training, and also single leg stance, but with weights. So for more progression and bone density and strength. We're going to start out with some massage ball work. And I'm going to just shift the camera around a few times to try to get better angles. Okay, so we're working on the pectoral muscles. This comes up quite frequently. The pecs are the muscles in the chest. And it's quite evident among the population that these muscles get tight from sitting at computers, and it pulls on the front of your shoulder joint. That makes the shoulders roll in, so a lot of us end up with posture like this. The best way is this is a corner of a room, okay, or a door frame. And first you just want to roll like that across the muscles in the chest, just below the collarbone and kind of around the breast. The hand should be facing forward, facing the wall. And your head should be always turned away and slightly down and go down so that you're not straining the neck. It's good to get into the corner right by the chest bone, by the sternum. Okay, and then if it's comfortable for you, if you can lift your arm up like this into the corner, and then you go across the tendons of the pecs, right at the edge of your chest, and kind of around the front, not on your arm, like not right on the shoulder, but around the edge of it, where your arm attaches to your body. Okay, and then we'll work on the other side. So first, just across the chest, wherever you're sore, always with soft tissue work. If you find a knotted area, you can just work into it a little more. Parts that are not really knotted, you can go over that a little more quickly. So head is turned away from the ball and angle down. Okay, and then you lift the arm up and go across here by the armpit kind of. Here, it's still your hand should be facing the wall. This is a really good corner. It's very comfortable for setting the shoulder and the head. So sometimes when we work on the upper back and the glutes, I do that on the floor. Today, for simplicity, it's clear, I'll do that standing up. But if you're familiar with what we're going to do next, you might just lie down on the floor. Okay, so we're working on here the upper trapezius muscle and going across levator scapula, supraspinatus. And first we want to go across like that, kind of horizontally at the edge of the base of the neck. So I'm starting on the left side and then take the feet forward so you're angled a bit. And then you can go right forward and back, toward the front and toward the back. Just at the base of the neck on the side. And then horizontally across between the base of the neck and the shoulder. So that's across along the upper trapezius muscle. Just above the shoulder blade. And then next, so the shoulder blade down here around the scapula, I like to put the ball just right at the edge of the shoulder blade. You can, and then side to side between the shoulder blade and spine. If the ball is slipping away from you, you can put it inside a sock and then just throw the sock over the shoulder. That works really comfortably. The working side arm, if you bring it across your chest, it gets the shoulder blade out to the side. And in that instance, you can get underneath the shoulder blade more easily. Okay, so that side to side and then up and down, whatever we like to do. Infraspinatus or shoulder external rotators right here. right where your arm attaches to your side. So if you put the ball right there, and quite often it's very sharp when you find the point, and sometimes it'll radiate down your arm or into your head. Okay, and now we'll do the other side. So first, like this, across the base of the neck, side across between the neck and shoulder, around the shoulder blade. You need to angle your feet forward so you can get more above the shoulder. And side to side, and if it's really knotted, you can just hold it with pressure. And here, you know, you can get a little more pressure if you're lying on the floor and do this, but it's a bit more awkward. Okay, and now a little lower across between shoulder blade and spine, and up and down along the edge of the shoulder blade. Okay, and then sideways, right by the underarm area here. Okay. So next we're going to just work on the glutes. The buttock muscles here. I like to start right at the top of the femur, the socket of your hip joint, so the ball like here, this area. And then, so we'll stand sideways, and then we'll turn toward the back and down here beside the tailbone and up here along the edge of the sacrum. And then back all out along, this is the pelvic bone, the iliac crest. And we'll finish off on the outside, but this time higher up, starting down a little lower, just at the top of the leg. And so you're directly sideways to the wall. You can, when you get the ball in place, you should feel the edge of your femur, that's your upper leg bone. And then in between there, there's a socket where the bone sits into the pelvis. Your leg bone sits into the pelvis. Then if you turn more to the side or towards the back, and still the ball is quite low in your hips, so now beside the tailbone, and you might lean forward a little. Some people are sensitive there, people who've perhaps fallen on their tailbones earlier in their lives. And now up and down or side to side, but you'd like to feel the edge of the sacrum bone, which is in the middle of the pelvis at the back. And now work up a little more vertically here, and then work your way out horizontally across the pelvic bone, the iliac crest, and then to the outside. So this is the little corner of the pelvis that often gets really sore where the gluteus medius gets a bit jammed. Okay, and now we'll work on the other side. So first, just above the femur. So the ball is here quite low in the hips. Okay. And then more toward the back. So you're working around the head of the femur, around the trochanter, in the socket of your hip joint. And then you turn sideways and then toward the back. Beside the tailbone, the coccyx, then up vertically. So the sacrum, along the sacrum bone, the piriformis muscle attaches around here, and the sciatic nerve goes through the piriformis and often gets pinched. So working on this area really helps for sciatica prevention. Okay, and out along the iliac crest toward the outside of the hip. All right, and then next we'll just put the ball on the floor and massage out the feet a little bit. All right, so just massaging out the bottoms of the feet. So I have toe spacers on. I do wear them, not all the time, but quite often. And particularly when you're rolling out your foot, you want to get into the forefoot at the base of the second, third toe. There's an arch called the transverse arch. Try not to twist your ankle too much. Keep the ankle more neutral, just work in the foot. And then the inside arch everyone knows of. Then there's also a lateral arch, which is on the outside of the foot. We'll deal with that later too. So right between, at the top of the heel there, between the heel and baby toe, there's supposed to be an arch there. Okay, other foot. The lateral arch in particular is where there are the most concentrated proprioceptors, like nerve endings, that sense balance. So this lateral arch is really the most important place to stimulate to improve your balance and prevent neuropathy and things like that. Okay, so on the floor, we're going to start out with using the ball in the back of the neck. This is also something just really common in our society. A forward head posture. So we'll use the ball and right here at the base of the skull, I just put it in a few different places along the base of the skull. So that first that will be like massaging a bit. You can work into the muscles as well if you want to. And then we'll put the ball like this, like right in the skull, right in the back of your head, so that it'll help the angle the chin down. It's for a lot of people, you might put the ball on top of a book or a small pillow or something like that, depending on your neck angle. When we go to the floor, we're going to go through our structural alignment series. You're going to need a few different items. Besides the massage ball, you'll also need a broomstick and a stretchy, not stretchy, but just a strap, actually, ideally not stretchy. So here's a strap. And something like a foam roller. I have a rolling pin. And rolling pins are really good if you don't like doing foam rolling. Okay, so first, the head. So we're going to work on alignment of the neck, preventing degenerating discs in the neck, and also just so you can move more comfortably in life. So first, we'll put the ball at the base of the skull. So this is when you might put the ball on a book. I have to hold on to the ball when I do this, and then just turn your head in different positions. So I don't necessarily roll around. I just adjust my head angle and put a little pressure, then adjust the head angle, put a little pressure, working from one earlobe to the other ear, basically, all along the base of the skull. And if you want to, you can spend more time and also try to massage out the muscles in your neck a little. So it's good if you don't want tight muscles, but also you need strong neck to hold your head in place. And that's why our necks are basically collapsing, because the muscles are weak. Okay, next we're going to put the ball in the back of the head. So this is when you might put the ball even on a pillow or keep it on the book. But your chin should be angled down. And take your hands on, okay, the TMJ joint. If you bring your fingers to the base of your ears, and then bring the fingers forward into your face, just about an inch, and open and close your mouth. Okay, and you'll feel your jaw moving, right? That joint, the TMJ joint. And then you press the fingers up into the joint on either side, and open your mouth all the way. And you keep pressing. We're working on evening out the tension of the pterygoid muscle, which helps the top and bottom jaw bones move correctly, helping your bite stay aligned. Close halfway, press. And close all the way, keep pressing. People who grind their teeth often or clench their jaw will often have one side much tighter, so you even it out. Okay, next have the arms just relaxed, shoulders relaxed, and we're going to nod. So we're gently releasing the skull. Take a deep diaphragmatic breath. So I like to focus on breathing into the lower back, not just your belly. That nod action. Think of expanding the lower back as you breathe, expanding your waist as you breathe. And exhale, relax. Next, keep your chin down and only move the eyes up and down. So this helps the vestibular system for balance, training your eyes to move independently of your head. And breath. Eyes up and down. And a breath. Okay, now we'll put the ball aside, and next if you could use the strap. So rather than just stretching, I'd like you to think of the joint systems. We're putting the strap in the right foot. Set up the right leg, knee over hip. So don't move your knee close to you. The knee stays over the hip joint. And then straighten your leg, whatever you can do, such that the knee stays over the hip. Your leg might be a little bent, that's okay. Flex the foot. And now we're just going to hold for a moment here. You should feel this in hamstrings, calves, Achilles, depending on where you're a bit tight, up into the hip joint. If you feel it behind your knee, I would bend the knee a little. You don't want to overstretch the back of your knee joint. Then take both ends of the strap in the left hand, wrap it around the back of the calf muscle so you have the strap in the right hand. Keep your leg very stiff. So don't twist your knee or ankle, but you want to rotate your femur, your upper leg bone, in the socket of the hip. So your leg should be totally stiff. Just like if you had a stick in the sand and you're like rotating the stick to make a hole. Okay, and then unwind the strap and switch to the left foot. Right leg is down. Left leg, the knee over the hip. Flex the foot. Keep the shoulders centered. Then take the strap in the right hand, both ends, wrap around the back of the calf into the left hand. Keep your legs stiff, don't twist your ankle, and then rotate the femur. So we're getting a better rotation of your leg in your hip joint. It should feel very easy and clear, like you're doing nothing really. If it's restricted over time, we'll help to rebuild the joint a bit, whatever we can do. Unwind the strap. They will put that away. And now the broomstick. So this is to align the pelvis. Right leg is knee over hip. And you put the stick in the back of the hamstrings. Left leg pull up into it. So you're in the front of the left leg, the quads. Keep the knees at a 90-degree angle. Keep the bar parallel to the floor. And we're just pressing the legs into the bar. Then reverse the leg position. The left leg is knee over hip. The right leg is on the other side, so you're pushing away from you with your left leg, pulling toward you with your right leg. Arms are straight. Chin toward the throat. You can have a little pillow under your head if you need to do that, but your chin shouldn't be going up to the sky. Okay, broomstick down. And now we'll just bring the arms out to the sides. Something like a Y position, palms are facing up. This depends on your shoulders. Your arms might be down more like a T. They might be even lower than that, or they might be a little higher, like a Y, or up like a V. Okay, next we're doing a stability ball rock. So we're just going to imagine that big stability ball on your abdomen, and you wrap the arms around it, then wrap the legs around it, holding it in place. So you're holding the ball in place and rock over to the left, bracing your abs, rock to the right. So you always maintain the control of your abs. You shouldn't be breaking apart in the middle. If you're falling apart, You can just for now hold the middle position. Okay, and rest. Next, we're going to activate the abdominal muscles. Reach the arms up to the sky. Bend the elbows at 90-degree, elbows over shoulders, and knees over hips. So this is our modified dead bug. Okay, for lower back should be a little bit of an arch, about a centimeter or so. Right leg push forward just about a few inches only and hold. And always maintain the same arch in the lower back. Right leg comes back, left leg forward, only a couple of inches and hold. Shouldn't feel this really in your thighs or in your back. Left leg back, right leg a little forward. You should feel your abs. If you are straining with your lower back or quads, then don't do the movement. Right leg back, left leg forward. You can just keep the legs in the set position without moving the legs. Work on building up your core strength. Left leg back. Okay, and now this is a little complex for the spinal rotation. You lie down on the right side, bring the left leg forward toward on the other side. Then left hand reach back in the direction of the right foot. If you can't get it, then that's okay, but just keep the leg back there. Right hand at the front is on the left knee. Head turned to the right. And chin toward the shoulder. Now, most important component here, the left shoulder and the left knee should both be the same height from the floor. The left shoulder back, left knee forward, same height from the floor. Unwind, turn onto the back. So now left leg straight, turn towards the left, roll over to the left. Right leg comes around. Right hand reach back toward the left foot, left hand on the right knee at the front. Okay, so the right shoulder is back and the right knee is forward. Both the same distances from the floor. The tendency is to just roll the knee forward. So think, where's your right shoulder, right knee? Even them out. When we do this one, if your hamstrings cramp, just don't hold on to your leg and think of using the glutes more. We'll do that next set. Unwind. Okay, so next we want to strengthen the neck. So you can have your hands on your abdomen or under the lower back. Left leg is straight, right leg is bent. Imagine someone pulling you from the top of your head, so your chin is toward the throat. Lift the elbows if you can, and lift the head if you can, but only such that the chin is in toward the throat and not leaving up toward the ceiling. Relax. Okay, then reaching from the top of your head, chin in, elbows lift, head lift if you can, without letting the chin go away from the throat angle. And down. Once more, lengthen the neck, chin in, elbows up, head up. If you can't lift your head, just keep it on the floor. And rest, switch. Left leg up, right leg is straight. In the lower back, fingertips touching, if that works for you, with your hands, or just have your hands on your abdomen. Okay, lengthening the neck, chin in. If you can, lift elbows. Keeping the chin in place, lift head if you can. If you lift your head too high, you'll lose the benefit. And relax. Lengthen, chin in, elbows. Keeping the length of the neck, lift the head. And down. Last one. Relax the right leg. Lengthen the neck, chin in, elbows lift, and head up. And rest. Okay, and next, a little quickly, we're going to go through that same series. This is our alignment work preparation before lifting. Right leg, this time we're just going to stretch. Right leg stretch with the strap. But again, the objective is to even out the tension across the joints. You don't need to pull your leg closer to you. Keep the knee over the hip and work on straightening the knee at that angle. Be careful of overstretching the knee if you're hypermobile. Left leg. Okay, so knees over the hip, the foot is flexed. The shoulders are evenly set on the floor. And also the hips don't roll over to the side here. The hips are centered on the floor. Okay, and we'll put the strap away. And the broomstick. That right leg hamstrings and left leg quads. Now be sure you don't put the broomstick right behind the knee joint. Should be into the hamstrings a little. And again, your shoulders and hips, those 4 points, everything centered. Reverse the leg position. The grip with your arms should be such that the arms can be straight, but shoulders are on the floor. Chin down again. Note how the chin will start leaving and going up. That hyperextends the back of the neck. So there is work to keeping the head in place here. Okay, bar down. Arms in the Y angle. And here you'll notice that your chest feels more open. You'll have better nerve conduction and blood flow down the arms. Okay, the stability ball rock. So we're take our cradle rock position, and this time we're going to rock left and stay there, just hold. Find your stable point. Rock to the right and just hold. Okay, then center and just relax. Okay, then arms up to the sky and knees bend. So the knees are over the hips, the elbows over the shoulders, elbows and knees 90-degree angles. Right leg push forward. Now remember the lower back. Right leg back, left leg a little forward. So the lower back should have a little arch. And as you're bringing the left leg back, right leg forward, as you're moving the legs, you shouldn't be adjusting the lower back angle. It should always be the same. Right leg back and left leg a little forward. And leg back. Okay, so then last time here, right side, lie down. Left leg goes around, spinal rotation. Left hand reach toward the right foot. If your hamstring cramps, just don't hold on to the leg, but think of using the glutes. Most important, left shoulder is back. Left knee is forward, equal and opposite. So whatever height your shoulders from the floor, the knee also, same height from the floor. Okay, and now we'll turn on to the left side. Right leg goes around. Right hand reach back toward the left foot. Left hand on the right knee. Okay, and now think right shoulder. How high is that from the floor? And the right knee. You should just even them out. Might be 6 inches, might be 3 inches, whatever it is for you, should be the same. Right shoulder and right knee. Okay, next we're going to roll out the quadriceps, the thigh muscles. So here you'll need either a foam roller or a rolling pin. The easiest way is to sit in a chair and just get a rolling pin like that and roll out the quads, the front, the middle, I'm sorry, the outside more, the inside, your adductors. Or you can do this on the floor. The foam roller or rolling pin, something like that will work. Or something, a bottle, I've often used a glass bottle. I'm starting above the knee. So I'm starting right leg directly above the knee joint. And rather than like moving a lot, I like to work small excursions here. Just move a few inches up and down, adjust your leg angle. So you're on the inside edge, middle, outside edge. We're not really working on the groin muscles and the IT band on the outside of the leg. We're still on the quads, but the outside of the quads, the front of the quads, and the inside of the quads. When you get to the hip, here, you'd like to go across the hip flexors, so just at the top of the leg, in front of the hip. And the IT band, or excuse me, the TFL, tensor fascia lata, which is at the top of the IT band. That's on the outside of the hip, right above the leg. Okay, and then we'll switch. So left leg just above the knee. And incrementally work your way up the leg. And adjusting your leg angle as needed. The front of the hip and also at the outside of the hip at the top. It's really important when you do the quads that you always have really good core support and keep the chin in, like you shouldn't let the head tip up. That will hyperextend your neck. Okay, so now we're going to do one alignment exercise for the spine. So we have good spinal control. What you'll need is a couch or a chair, like a soft chair. We're lying on the floor. Many people are familiar with glute bridges or hip lifts to activate the glutes. This version also will balance out your sacrum, keep the hips level, but you need to be aware that that's what we're trying to accomplish here, okay? So here's my soft chair. If it's a hard chair, it'll dig into the calves. You won't be able to do this properly. So it's single leg hip lift. We're starting with the right leg up. Left foot on the floor, the upper leg is straight and the foot is flexed. Toes pointing straight back. On the left foot, toes are pointing forward, arms by the sides. Chin in. Now your glutes, your buttock muscles, squeeze them from the sides. Exhale, lift. And think of using the glutes. Your hips across the front should always be level. The upper leg should not bend. We're doing 10-second, 15-second holds. And lower. Left leg up, right foot on the floor. Left leg is straight, foot flexed, toes are pointing straight back, not out to the side. Chin in, brace your abs, engage your glutes, exhale, lift, and hold. Keeping the hips level across the front. Keep using the glutes. Try not to just use your thighs, the front of the legs. You should be feeling the muscles in your butt. And lower. Switch legs. Right leg up, left foot down. Now lower back. Pay attention. Before you start, slight arch in lower back. Keep the same slight arch all the time. Right leg straight, glutes engage, exhale, lift. As you lift, your back should not increase the arch. Keep that neutral spine, squeeze the glutes. Keep the right leg straight. Breathe. And lower, keeping the neutral spine. Switch legs, left leg up, right foot on the floor. Glutes, chin in, neutral spine angle, left leg, keep it straight, and lift. Okay, so as you come down, keep that same neutral spine angle all the way back down to the floor. Excellent. Switch sides, one more time each side. Right leg up, leg straight, chin in, shoulders back. Brace your abs, then lift. Glutes, most important is you're using the glutes to keep the hips level. And lower. The neutral spine is really critical here. Left leg up, right foot on the floor, chin in, neutral spine, glutes, brace the abs, lift, keeping that same lower back angle, keeping the hips level, chin in, slowly lower, don't flatten the lower back. Perfect. Okay, so from here we're going to stand. I let you roll to the side, don't sit up on an awkward angle. Okay. Excuse me. All right, so now you just walk around for a moment. Now we're starting our weightlifting. And first we're going to start out with deadlifts. And today our position is neutral. You can use either a bar if you have, most people don't. Kettlebell is the easiest grip. If you don't have a kettlebell, you can use a dumbbell. The dumbbell grip is should be like this at the ends of the dumbbell, okay? I have a small bar here. Okay, and if you have a kettlebell, you would just hold on to the handle like this. For muscle tone building, we're doing sets of 30. And the position is neutral stance. As you do the hip hinging, you think of brace your abs, brace your lower back, and push the hips back, pressing the feet through the floor and always thinking of using the glutes. The feet are just about hip width apart. Both hands are holding on to the weight today. Okay, so standing tall, chin in, brace your abs, brace the lower back, push the hips back. First set, we're thinking of the feet, pressing the feet through the floor to stand. And rest, weight down, and just walking a little for recovery. Okay, the second set, we're going to focus more on the glutes. Imagine a giant set of pliers. So there's a pliers like that, and the head of the pliers are here. And squeeze the pliers from the side. Squeeze in like that every time you come to standing. Okay, both hands holding on, feet just about hip width apart. Stand tall, chin in, shoulders just slightly back, not jammed back together. Brace your abs, lower back, hip hinge back, and from the sides, think of squeezing the buttocks together. Okay, and rest and recovery walking. Okay, one last set of the deadlifts we'll do for our bone density and muscle tone. So this time, the focus is the breathing. Exhale as you lift. You should be lifting the pelvic floor as you stand. Breathing out, should feel a contraction of the glutes, lower abdomen. Those actions will stabilize the lower back. Okay, one more set. So just get the weight. Make sure we have a good start position, chin in, shoulders are a little back, your abs are engaged, lower back is braced, glutes are engaged. Then start hip hinge, and exhale, stand. And rest. And perfect. Okay, so now for our upper body lifting, today we're going to do biceps. On our Monday classes, we do overhead or chest pressing. And then today also we'll be doing various pulling and pushing on diagonal. Okay. Okay, so bicep curls, if you have a bar, so you would just go like this, a bar curl, barbell curl. If you don't have a bar, you're welcome to do 2 dumbbells. I personally don't like to use 2 dumbbells. I find people are too skewed when we do that. But for the feet, if you want to join me, I put this is something to stimulate the outsides of your feet. You can use 2 pens. Like this, you can use 2 pens for the arches, okay? And I have this elastic band that goes around the toes, the 2 big toes. So you need either a bar, or I'm just using 1 dumbbell. That's all I have here from Costa Rica right now. It's really exciting. Okay, so the feet business goes, sorry about these angles. I'm gonna get everything. Okay, so the pens would go on the outside of the arches that I mentioned earlier, the lateral arch. And an elastic band around the big toes. those actions will really help your arches to strengthen. Okay, so big toes and pens just above the heel on the outside of the foot, lateral arch. Okay, so barbell curl, elbows by the sides, and just curl. Don't let the elbows sway back and forth. And we're going to do 5 sets of 15. I'm just doing one arm. So first, get your weight set, standing tall. Your knees should not be locked, they're a little bit bent. But use the glutes and abs and curl without letting the elbows move around. The elbows need not be jammed into the sides, but they should not be moving around as you curl. And rest. So I'm switching arms. Okay, and second set, chin in, standing tall, brace your abs. So as you're lifting, your lower back angle shouldn't change, just like we were saying earlier. Your glutes are engaged, your abs are engaged. Okay, and rest. This time we'll focus on our posture a little more. Okay, so standing tall, pull the chin back, chin slightly angled down, elbows by the sides. As you curl, do not allow the shoulders to roll forward. Keep the chin in. The tendency is to let the head go forward and let the shoulders go forward. Think of keeping the chest up, and the chest is wide. However, don't let your lower back arch out, always keeping that neutral spine angle. And rest. Okay, set 4. If you're doing one dumbbell, switch sides. Okay, and this time exhale, think exhale as you lift. Breathe out. Lower abdomen contracts. The pelvic floor lifts. Those actions go together. Make sure you're not using your quads. Last rep here, weight down. Okay, so I've been using a dumbbell, but for the last set, I'm going to just use the broomstick for alignment. This is our last set, so whatever you do, I would definitely do the same on both sides. So chin in, standing tall. Think of lengthening the spine. Engage the glutes, not your thighs. You shouldn't feel your quadricep muscles activated. Glutes and abs. And don't let the shoulders roll forward. Have a grip on the bar. Thumbs to baby finger. Keep the baby finger pressing. Should be even grip both arms. And rest. Okay, so now working on balance, today we're going to do a single leg hip hinge, but only a hold. So it's just a stabilization position. The weight, it would be a heavier weight is best. We're doing a 30-second hold. So I'm still using something like a pen on the outside arc. Okay, so single leg hip hinge looks like this. You hold on to the weight with one hand. The other leg is up. If your balance is really bad, you can just stand like this, or you can do this hinging action. And I'm just going to do the hold in the hip hinge position. starting with right hand has the weight. So naturally, if you use something loaded, a weight, resistance, your bones and muscles will get stronger than if you just use body weight. Right hand is holding on, right foot up. You can just hold right there or hip hinge. And carefully stand and rest. And of course, it's best if you have to hold on to a chair or whatever, that's okay for now. Right foot supporting. Left hand has the weight. Make sure the hips stay level. Don't lift one hip up higher than the other. Left hand has the weight, left foot up. So you can hold this position or keep the chin in, everyone. Hip hinge and hold. Should feel this mostly in the right glutes, and yes, your right foot is working, not your left shoulder. Left shoulder is really quite relaxed. Shoulder blade is down from the ear. Carefully stand. You can get a little bit of a hamstring stretch. If you feel a lot in the hamstrings, they're probably just really tight. Next, we're just going to do a second set of the same. So left foot is supporting. Right hand has the weight. And either right foot up and hold, or hip hinge and hold. And rest. You see, what happens if you lose control of the glutes, then the upper traps start to activate too much. Okay, right foot supporting. Left hand with the weight. Okay, so left foot up, either hold here or hip hinge and hold. Keep the left shoulder down from the ear, keep the chin in, keep the hips level, and your balance will be fine. And stand. Perfect. Okay, so now back to upper body lifting. If you have a kettlebell, that's usually the best for doing a diagonal lift for rotational core. The angle with a kettlebell is you would hold on like this, like not at the top, but like this, or close to the ball part. If you have a dumbbell, I would hold on, if it's a light dumbbell, so this one's light, so I could hold on like this. If it's a heavy dumbbell, you would do like that, one hand and other hand covered, okay? That helps to set the shoulder angles. We're having both feet are side by side, and toes angled forward, but a good like athletic type stance. We're starting with a diagonal lift, hip toward opposite shoulder. We're going lifting from right hip to left shoulder. I'm counting a set of 15. So this gets full body, upper body strengthening, and rotational core work. Okay, and rest. It's important when we do this kind of rotational work that you don't twist your waist. You want to be very stable like that. So you're driving the action from the shoulder girdle. Other side. Okay, lifting left hip toward right shoulder. and rest. Great. And next we'll do one set of a chop, so that was diagonal lift. Now we're going to do diagonal pull. Best is if you have a band attached up high, it should be very loose, like the TheraBand. And you would pull like this, just diagonally across. And again, you don't want to twist your waist, you want to be very stable with your obliques and your abs as you're pulling across. We're going to start lifting high right, low left. The grip, if you have a band, would be right hand underhand, left hand overhand. I don't have a band that I can attach, so I'm just going to use this broomstick. Make sure you have an athletic stance. It's similar to the canoeing action, but here we're being very controlled and stable with the midsection and training the movement from the shoulder blades. Okay, and then switch sides. Left hand underhand high. So even here I have left hand underhand high, right hand is overhand low. Have your hip hinge position, right? You're a bit like this, athletic stance like a boxer, and then diagonal pull. So it's horizontally or diagonally across the body, high to low. Not so much front to back, it's more of a side movement. And rest. Okay, so thanks for joining me today, and we'll continue our training next session. Have a great week. Particularly with this rotational core movements, why people get hurt often playing sports, like in gardening, people twist their back, their back is sore. Walking, we get twisted a bit and then the back is sore. Golfing is a great example. If you don't have good movement of the shoulder blades like that and of the hips like this, then instead this part twists and then the spine gets, not just sore, but herniated discs and all that. So thanks everybody. Have a great day. And thanks for coming.